Okay. Perfect. So welcome again to the Children's System Advisory Council. My name is Chelsea Holcomb. I use she, her pronouns, and I am the Director of Child and Family Behavioral Health at the Oregon Health Authority. We definitely want to invite all of you to turn on your cameras if you feel comfortable, maybe put on a beret or turn into an animal as we meet today. I have stepped back in to facilitate today after we didn't meet in April, had a really powerful meeting in March, and wanted to come back in and connect with this group and have some conversations about that March meeting, and then potentially advisory from this group of next best steps and how to incorporate some of what you all heard and learned in the March meeting, and even if you weren't in the March meeting, of the suggested actions that came from that and these conversations we're going to have today. I'm going to try to share my screen. Let me see. I was also saying before people were joining is that I also did the slides late, so I apologize. They were attached to the meeting this morning by Tamara, but I apologize, it didn't come faster, or earlier, I should say. Okay, let's give this a shot. You guys see my screen? There it is.
There it is.
Okay, great. And I'll proactively let you know that my computer only usually totally freaks out when I'm presenting or running our team meeting. So I apologize in advance if that happens. Okay, you all know who you are. Let's see. So what we thought we would do today, and we'll definitely temperature take as we go, is do some welcome and introductions. So if you all in the chat would like to throw in your names and pronouns if you feel comfortable, and your role. It would be helpful too. It sounded like last time we had a huge OHA turnout from multiple different departments. So if you do work at OHA, it'd be really helpful to acknowledge that and call that out. So we can go ahead and do that in the chat. Again, I think my hope today is to reconnect and then hopefully facilitate some good conversations so that we can do more listening and learning from this group. And then talk a little bit about the current roadmap and planning and next meetings. So that's the goal. It looks like Roberta is still having issues with audio. I might try to reach out to her real quick and see what's going on. All right. I also had fun with graphics. So let me pull up the chat so I can actually see it on my other screen. And I'll rely on you, Tamara, and other child and family team folks. If there's things that happen in the chat that please feel free to interrupt me or slow me down, or so that we acknowledge that. Okay. So in past CSACs, we've given space and time for announcements from our system partners and family members and young adults and youth. So wanted to give some time for any announcements or things that would be helpful for this group to know. You can either put them in the chat or come on camera and unmute. And again, this could be everything from we're having an event, please share, this training opportunity is available, or anything that's going on from your perspective that would be helpful. We just wanted to give some space and time for that today. Roberta, you got on. Is your audio working? Okay, good. You were 3 little bouncing dots for quite some time. So from Jill in the chat, the Youth Suicide Intervention and Prevention Plan that we have in Oregon, we do an annual report to the legislature, and that was recently published. So Jill put the link in the chat. A lot of good information and an amazing work that's happening across Oregon.
Chelsea, I have my hand up. I'm going to put it down.
Oh, thanks.
I will put in the chat in a minute, but we are restarting the CSAC parent policy group, and that will meet on June the 1st for the first time. So if any of you didn't receive an email or invitation and you are a family member and want to be involved with that, then you're welcome to either put your email in the chat to everybody or just alter the tab and send it just to me, and I will be happy to send you an invitation and the information for that meeting. I think it's 2 o'clock on the 1st. We'll then send out some more requests around when people would prefer to meet, so we make sure we do that, and to make sure that we just to say we will also set up some specific Spanish language sessions separately, and to let folks know that that's happening, and that we're starting to look again at the roadmap, and I'll put the link to that in the chat too.
Yeah, thank you, Hillary. And just at context for folks, could you also put the link to the report the previous policy group did to help inform the first roadmap? Thank you.
Can do.
Thank you. Any other announcements? And those can be, if you think of something later, feel free to just pop it in the chat, and Tamara will collect all and be able to send that back out to you after the meeting.
Chelsea, I wonder if I could give an announcement as just a heads up, as a calendar hold on June 14th from 9 to 11 a.m. We are working with some partners to gather folks for feedback around Black youth suicide prevention action planning in Oregon. And so we're specifically looking for help in recruiting community members, parents, faith leaders, folks doing good work in Black youth wellness. And so it's all, I don't yet have an invitation, and just have a calendar hold. And so more information will come out. I'll put it in the notes for Tamara to send out to you all, but I wanted to say it out loud so folks could start thinking about who you might invite, and or putting a calendar hold on your own calendar if that's you.
Thank you, Joe. All right. Think of more, put it in the chat. So wanted to start off with some gratitude, and I don't know if I can see everybody, but Nakobe, who's been holding and supporting and co-facilitating and at times facilitating CSAC from our Office of Recovery and Resilience. Just a huge amount of gratitude for the work that they have been doing and supporting for this group. Even before they came to OHA, they were working at Youth Era supporting this group. So for a long time, really trying to push this group and our unit to really show up and do better and show up differently. And so I think just really wanting to express gratitude to the work that she did going into and developing and planning the March CSAC meeting. And using relationships and support of the folks that came and presented, and even other OHA staff that were able to share and support the work. And I think the more energy we put into the times we all choose to come to this space, the more we're going to get out of the work that we do together. So I think she's put a lot of energy and support. So I can't, from my screen, I don't see her here today, but I wanted to make sure that I acknowledged and thanked Nakobe for her past support and future support of this group and the work. The other thank yous is for all the presenters and the other OHA staff that came to the March meeting. I wasn't actually here, but I was able to listen to the recording, and we've gone back and pulled out information for us all to talk about today, but also recognize that over 25 OHA staff were in attendance at the March CSAC meeting, which is really, to me, I'm seeing little hearts pop up. I mean, that gave me goosebumps reviewing that, because we often as a unit have felt like the squeaky children behavioral health and look at us, look at our work, and to have 25 OHA staff take time out of their schedules and really reflect and think about with you all the work that they do and how it relates to children's behavioral health and how we can show up differently and better for the Black community, that felt really meaningful and hopeful for me. So I'm encouraged, not with an expectation that 25 OHA staff come to a council meeting every month, but I think it gives this council a good opportunity and a window into how many things that your advice and your advising could impact within this organization with that many OHA staff paying attention. So it doesn't have to be just me. Is there anyone else who wanted to just take a moment of gratitude, either specifically about the March meeting or this group? Again, I was able to listen to the recording after, but I wasn't present. So I just want to open it up to CSAC members or other people who are present. Roberta?
Thank you. It was very powerful to hear the experiences that people shared, and I really appreciated that. I think, it's very easy to forget we're here to help and provide guidance and advice on behavioral issues. And unless you've really, lived them, it's hard to understand how that connects. And one of my 2 BIPOC children attempted suicide because of racism in school and by students and staff. And so it was really powerful to hear everything that they said. And I loved at the very, very end that they asked, several of them were talking and asked, well, how does our coming and sharing our stories make change happen? And that was powerful to hear that question as well. So I really appreciate that was organized and brought here.
Thanks, Roberta. Yeah, it's that then what question. Then what, right? Well, hopefully we're going to do some of the then what's today. Well, again, if you feel the need to express gratitude during the meeting, don't hold back. Gratitude practice is contagious.
I'll go, Chelsea. I know you weren't able to be here, but I think for those of us who were from the unit, I can kind of speak for some of us. I agree with Roberta. It was really, I felt so grateful to have so many people come and spend their time with us. And I think just the power of so many stories and the kind of the shared wisdom of the group really kind of, I think felt important and vital for the conversations that we need to have. And I'm so looking forward to this conversation because I also have been sort of waiting for okay, now what? And kind of, how can we follow up and make sure that we don't lose that momentum? So I'm looking forward to these conversations today. And just so grateful to Nakobe. And I guess just to say out loud here, Nakobe's not here today. And we have really worked with Nakobe on some of these next steps and expressed our gratitude to her as well directly. So we're saying thankful to Nakobe here in her absence, but we have said it to her as well directly. So just to make sure that that is passed on. And I think, yeah, so I think the other thing that I was going to put in the chat, which kind of goes along with what you were saying, Chelsea, is just having so many folks from across OHA be present. And sort of one of the questions at the end was, okay, what is OHA going to do about this? And I think the piece that made me feel optimistic is because we do have so many folks from OHA here, even today with the follow-up, because it's not just on our unit, it's for everybody. And I think that we spend a ton of time at OHA sort of working within our own little silos and really making sure that we have those connections and seeing that sort of shared goal and shared kind of motivation to help particularly Black and Brown children living in Oregon, dealing with mental health issues. It made me feel really, yeah, I think motivated and connected to the other parts of OHA. So my hope is that we can continue that as well. So.
Oh, I think Nakobe is joining us. Did Nakobe
Okay.
log on?
Hi,
Hi, Nakobe.
right now.
Hi, Nakobe.
We're hoping that,
Apologize. I'm just gonna be listening.
no, you're fine. We were just having, we were just sharing and expressing our gratitude for you. And so in your absence, so hopefully you also felt it through the universe.
Oh, thank you. Maybe that's the sunshine today. I don't know. Spring came early for us Oregonians.
Absolutely. All right. Well, so what Tamara did is listened back over the March meeting and was able to pull out recommendations and things that were discussed during the March meeting to get more concrete, and that is attached to your the invitation. I've also put them on the slides. I'm going to review them quickly because I want us to have much more time in small groups to actually have conversations so that advising can commence and learning can commence. But I think it's helpful collectively to just go through. And by no means is this exhaustive. This is what Tamara was able to pull from. So our hope in the small groups is you'll be like, but I heard this, or this really stood out to me. So don't feel limited by the list that we gathered. So some of the areas that were talked about from people expressing their own experience and from the providers we heard from is, a theme around improved language access and access to providers that speak the language the person is most comfortable with. Thinking about comfort with technology, we through the pandemic have definitely learned to be more reliant on technology. An example, of course, all of us being in little boxes and not in a room together, but being mindful of that. A focus on rural areas to improve the access to culturally appropriate behavioral health. Looking for, again, incentivizing local governments to prioritize building up the Black workforce, a protective value for children and seeing themselves in the professionals around them. And then recognizing that people of color are not represented in trials for interventions. And so a lot of times when we're talking about evidence-based practices or other things that are part of the behavioral health system, often the research and things come from, not all, but some are like, middle-class white folks, for example, and then it is broadened to all communities. And so really making sure that as we're funding and looking into those models that we're making sure that communities of color have been involved in that or adapting those practices with communities of color. Culturally specific suicide prevention, reimbursing non-traditional and culturally specific services, this one around community outreach is something that's really top of mind for us within OHA and other state agencies. I was just in another group from the Early Learning Council this morning around really looking at what are the best practices and principles around community engagement and really being intentional and leading with our desired outcomes, which I think, again, as Roberta brought up, I think having this group, us really thinking together of if we're bringing and inviting folks to this group of how we want to do that really intentionally, and making sure that we're supportive. Increasing funding to improve access for culturally specific peer and family mentors and life coaching. So again, not making it all clinical. School to prison pipeline, diversity of the workforce, and increasing diversity at the decision-making levels. I mean, I think it was brought up at the end of the meeting as well, that the Children's Behavioral Health Unit is not reflective of all the communities that are served in behavioral health. And so, you know, identifying that and naming it, but also looking at, so what does the unit need to be doing and doing differently to transform ourselves so that we look like the communities we're serving, but also with the staff we have now, how are we intentionally reaching out and collaborating with communities of color to make sure that we're elevating and amplifying the needs of those communities. The overrepresentation of Black children in foster care. And so again, looking at that implicit bias training, least invasive interventions. And I think it said restorative services, but I changed it to practices just because in our world, restorative services is actually a service, but restorative practices. And then again, looking at that birth to prison pipeline. So people getting in trouble with the legal system instead of getting access to treatment, separation of families. And then us really taking into account that intergenerational trauma. Doing things differently, right? Earning trust of communities, music therapy. I really loved the presentation around, again, some therapies on the way they've been outside of the clinical practice are actually clinical practice. And so recognizing these, it keeps being called non-traditional, but like actually having what works for people be the intervention that they have access to. And resources for families. So again, you have the document, and if you don't have it, let us know and we can send it to you. And these are the conversation as CSAC ended, some people had left, but some people stayed on and had sort of a longer conversation that Roberta talked about. And so really, this felt really powerful for me, who wasn't there, and for our unit, of making sure that, again, that intentional community engagement. You know, as the group was here to present to you as a council, we also recognize that we as a unit are intricately connected with you, right? Like you're here advising us, but we didn't show up in the way that we would have liked to for the March meeting. And weren't there to answer some of the questions and the calls at the end of the meeting of sort of the what next, who takes notes, who follows up, like what is this, where's the meaning part of it? And we were not prepared for that. And so we want to own that and make sure that we're partnering with you all and anyone that we ask to come here to present to you, so that we're ready for that and that we know what we're actually, the outcome of the engagement is meaningful. All right. Any questions before we sort of do the prep to go into small groups, or anything that we in this document missed that anyone wants to bring forward for the whole group before we have smaller discussions or smaller group discussions? All right. Carol? And Carol, if you're, oh, there you go.
Sorry, I'm not great with this stuff.
That's
So,
okay.
I unfortunately I missed the March meeting, and it sounds like you did an excellent job. I'm I'm really concerned about the pieces of, or the services that we get for kids in Eastern Oregon. And that is a definite, it's just in the 40 years I've been doing this and I'm now retired, we definitely need to, and it's probably not the it's kids in the rural parts of Oregon. So that is something that definitely needs to maybe be added in there, is how are we going to get really good, positive services to kids who are in the rural communities. Thanks.
Yeah. Thank you, Carol. Thank you. Absolutely. All right. Anyone else? So we'd love to have some smaller group conversations, and these were, as we were talking with our other colleagues who do more and do different types of community engagement, some prompts for it. You don't have to answer all these questions, but some prompts for the small groups to have some conversations. And I think, Carol, to your point, you certainly don't have to have been here in March to participate in that small group discussion. I think even listening to others of what they heard and what they needed to hear, and thinking about how what the council wants to do with this information and or what OHA should do with this information can be a really helpful conversation. So I invite you all, even if you were not here in March, to participate. So I think our thought, it's 10:30 now, of giving you a good, 20, 25 minutes of being able to have a conversation. You can certainly ping back to the main room if you're like, we're done, we solved all the things. You're welcome to come back to the main room. But really wanting you all to have enough time to have a conversation. As Roberta said, like the meeting was very powerful, and there was a lot said, and there's a lot to unpack even in these. It's easier to look at slides of like, oh, look at these recommendations, which one should we do? It was much more meaningful having it come from the Black community, of what their experience is of our behavioral health system and how we need to show up differently. Okay, so Tamara, do you want to do rooms of just random rooms? And I'm just looking at how many people we have here. Maybe 4.
Can do that. 4 rooms.
1, 2, 3, 4.
Don't know if you saw, there's a specific request in the chat that Roxanne would like to be in a room with Clyde. So if we could do completely random, except for that request.
Nice.
Thank you.
And let's do 5.
We're just in
Tamara.
the same, we're in the advocacy club at our school, and just want it'd be cool to be together.
So bear with me because I'm not sure how to do that. This is my first try at breakout room, so I'm going to assign automatically, except for then Roxanne I'll have to figure out how to pull you
Clyde,
out.
what's your Zoom name?
5CA-Clyde W.
Okay.
Cameron, it should let you pull people, it should let you move people around once you push rando.
Perfect. Thank you.
So again, the goal is, and I always hate to do this, but if you could have someone taking notes of some sort, we are going to come back together to have some conversations. And again, we really want you all to feel like you're in an opportunity to advise. You're advising OHA and many more OHA people than just the unit, because of all that participated, and we'll be communicating the conversation that we have with you all today back to those that participated as well. So want to give you enough time to do that, but also please take notes or be ready to come back and share with this group so we can capture it here.
Chelsea, I think people may lose the main chat if they go into groups. That used to happen. I don't know if it does anymore. but I think we can put those 5 questions that you had, we can put them in the chat that Jill
Sure.
just did.
The main chat will stay. It's like if you're in a Zoom room and you chat, that doesn't show up for everybody.
Right,
But
perfect.
you should
Okay.
still be able to see what I just did.
Just making sure people will be able to see the questions even when they're in the groups.
And it should be on your agenda as well, which is attached to the invite. So if chat is not working for you, that document should have them as well. All right. Good job,
And-
Tina.
Thanks. Zoom is user friendly. I didn't assign you, Chelsea, but feel free to pop into one if you'd like to.
Sort of moving in and out.
Yeah, I won't be able to join a Zoom room, but I'm just know I'm like in here on my virtual phone thing. So I guess it's me, you,
Oh,
Chelsea.
do you want us, Nakobe, do you want us to put you into a room?
I don't think I would be as productive in a room since I'm sitting
Okay.
in the
Yeah, that's fair.
craziness driving to Salem. But I do
Oh,
appreciate the intro and all of that. From what I've jumped into, I'm just really proud of your team for this structuring.
thank you. Well, thanks for even joining by phone with the drive.
Kimmer, do you need help? I know there's a couple more folks and I see you working. Elena had asked if she could still go into a room.
Yes,
You can
room
manually
4.
now sort of send people places.
She is in room 4. Elena did it. Oh, there she goes. Yeah.
Good morning. This is Lisa. I'm joining late. I tried to join from my car and the phone number was Hillary's number. And so I just called her directly. And then I'm like, well, this isn't going to work. So I'm just going to hurry down the freeway and get to my office and join. So here I am.
Lisa, oh my gosh. Well, we're going into small groups for discussion on the March meeting of the information that we received from members of the Black community with recommendations and experiences, and that should be attached to your invite as well, the information if you weren't here. And the sort of prompts for the small groups are something I learned, something I needed to hear, something I think could have gone better, and something I think CSAC could do, and something I think OHA could do. And maybe I'll put that back in the chat again, because you may not have the chat because you just joined.
Yeah, thank you.
And then we can get you assigned to a group.
It looks like you're sending me to room 4, so I will join.
Good to see your
Thank
face.
Thank you.
Perfect. And then Carol, did you want to be assigned to a group? And if you're talking, you are muted.
Carol is assigned to group 1, so just maybe hasn't joined.
Okay, perfect. Well, let us know, Carol, if you have any technical assistance issues that we may or may not be able to fix.
We'll do our best. Yeah, I went to a room and my room randomly also had Jill and Christy and Shannon in it. I was like,
A
oh,
lot
this
of
feels like too
OHA
many of
people.
us. Stepping back out. We're gonna overwhelm.
You could possibly go to group room 3. Does not have any OHA people.
We could be a group together.
That's true. We could be. I know, since we're so busy, we have trouble even connecting. We could connect now.
Yeah.
during CSAC.
I'm in traffic, so I mean,
Oh,
all
no.
I'm doing is staring at the back of like 3 trucks right now.
Oh,
So
no.
Oh, we do have some folks that are coming back to this space. So hello. Elena, did we manage to get you into a group?
Some technical issues.
Can you hear me okay?
Yeah.
We can.
Yeah, I had to get off my phone and get on my computer, so it kicked me out. So if you want to go ahead and send me to your room, that'd be good. Sorry about that.
No, you're fine.
And welcome, Maisha. Can you hear us?
Hi, Maisha.
Hi everyone, sorry. I am on my mobile. I joined a bit late because I was in my daughter's counseling session.
Maisha, thank you again so much for just being a part of the last meeting. And your daughter literally has like been my like source of strength and inspiration since then. So let them know I say thank you times a million, and their artwork is amazing.
No, we definitely appreciate being able to participate and join, and I will definitely share the information with them when they get out of their session.
Well, Maisha, what we've done so far is did sort of rounds of gratitude and reviewed from the March meeting the recommendations and experiences and pieces that people shared, and then have some prompts in the chat, which I may pop in again if you can't. It's probably on the mobile, so it's harder to see. But small groups are now meeting after reviewing those recommendations and the information that was shared, looking at sort of the things that people learned or needed to hear from the presentations and the groups that came in the March meeting to this council, things that could have gone better for the meeting and the community engagement, things that CSAC could do in response, and things that OHA could do in response. So that's what the small groups are working on now. Would you like to Tamara can pop you into one of those groups so that you can participate in the conversation?
Sure, I'm game for that.
Nice. So Tamara, so hopefully you'll get a prompt on your phone. And then Carol, are you with us? Well, welcome back as people are coming back and turning into animals. We have a lot more people than when we went into breakout groups. So hopefully I appreciate you welcoming folks that came in into the conversation, even if they were just able to listen as they were able to join our time together. So this is our report out time. So is there a group that would like to go first and just talk about what came up in your time together and what you would like to share with the larger group? Looking for volunteers.
We were group one, happy to start.
Perfect, thanks.
So this is not my voice, this is the group voice, and please, anybody who was there, join in. We had, so the things that I summarized from the group were the need for intentionality around much of this, and that that often gets in the way when we're not intentional. So racism is real, and there were some comments around it's not getting any better, and that what the biggest need is is for providers that identify with and or are part of that community, so that young people can see themselves and are not having to do the educating of the group. another thought that came up was around contracting and how we give protocols to go directly to community-based organizations as opposed to going through big, heavy RFP processes that exclude so many of those community organizations. Also, just overall, the need to rebuild trust and questioning how do we address issues in rural areas. And I heard an exhortation to just do something. Don't get stuck in doing nothing. The need to keep moving forward, even if we get it wrong, that is more important than worrying about what that action is going to be. And, you know, just again, the need to continue to look at biases in things like hiring and doctors, promotions, all of those things need to keep going. And so those are some of the things I took that came from our group. Would anyone like to add anything to that? So I just want to thank everybody for participating. Oh, Joylene, go for it.
Thank you, Hillary. I just wanted to add just a wider ask to anyone here that if you all in your positions have any level of power of where money is directed, that, you know, it go directly to community-based organizations that are trying to diversify the workforce in behavioral health. I talked about a little bit of my experience trying to get a Black woman therapist and having to pay out of pocket for her because she's like 2 states over. And so that there's like significant privilege that I have in order to be able to actually access that. And it's taken years to get that far. So if there are community-based organizations that are diversifying the workforce or, you know, trying to intentionally hire specifically Black behavioral health workers, not just people of color, but Black specifically, that would go a long way. And I think that could help with a lot of the things that were brought up today in March. Thank you.
Yeah, thank you, Jolie. Anyone else from group 1? And also feel free to use the chat. I was thinking earlier of that recognition of technology and being on camera, being off camera, muting, unmuting. Please feel free to use the chat, or even we can put some of our email addresses if you want to share thoughts after the meeting, or even talk in a smaller group after the meeting. You know, please let one of us know.
I can add emails in the chat now, Chelsea. I'll do that.
Oh, thank you. I don't know if you all know the numbers of your groups. Group number 2, I'll just call out group numbers and see if you knew what group you were in. We should have named them. Does another group want to go?
I think we were group 5, so I'll wait. I don't know if that's right.
I'd just go for it.
Okay, cool beans. I was a note taker. We had a robust discussion, and here are the things we spoke loudly of. That listening, hearing, and validating is truly important, so that we can know better and do better. However, the strategy and policy change is really needed, and the implementation and follow through of those strategic points are what the focus wants to be. Answering the now what question, needing infrastructure, needing resources in terms of funding resources and human resources to support the organizations and the communities to implement and sustain the growth that is needed in these areas, to create and incentivize and support growth. The data is loudly supporting these stories. We are waiting for and needing better SOGI and Real D data specificity to do that backup. But the group really talked about wanting to prioritize the issue, knowing that OHA has been there very successful leveraging flexible and less restrictive and accessible funding when they are prioritizing the issue. And so really encouraging OHA to do that was what the group talked about. If I missed anything, group members, please speak up.
Thank you, Shannon. Roxanne, you're the cool kids group. Why don't you go ahead?
We're the cool animals, right?
Cool animals, yeah.
We had an equally probably robust conversation about the need and the current work actually to combine the efforts of the work to address specific needs in the BIPOC community with the specific needs in other communities that are experiencing disadvantages because of the community they're in, such as the LGBTQ plus communities and rural communities and individuals experiencing suicidality with the bias going on with that going on, and just to combine some of those efforts so that at least with like a liaison from the different areas of initiatives to address the concerns and make positive change. Because we have like a ton of nonprofit organizations in Oregon, and we have the Oregon Health Authority, and we have a lot of interest groups, a lot of people working to make change. And we tend to duplicate a lot of work and use funding for those duplications when we could actually come together and make so if there was a cog in the middle and there, you know, all the different groups were participating, the momentum of that could potentially make greater change with the same funding and utilize what we already have. And we have a lot of resources that aren't really being effectively used and could be, and we could make a greater change in a shorter amount of time with the people who are dedicated to this work. If we could possibly do that, and we were talking about the efforts to combining efforts from the OHA and ODE with the Department of Education that's happening right now with the student success stuff, and I think that doing the same kind of thing with addressing specific concerns in the communities, like I said, experiencing disadvantages for their whole wellness because of the communities that they are a part of, and the biases and the racism and the on the stigma that's happening in society, in our combined community of Oregon, you know, within that community. I think that we could make a huge difference. And we talked about, all of us contributed, and it's not just I think, but I'm sharing my own thoughts, and I encourage the other group members to share. I'm probably not giving it justice as much from everybody's perspective, but was the overall arching theme of our conversation.
That's great. And the eyes on your avatar is like, you emphasized well with those eyes, the bear eyes. Oh,
Thank you. Thank you very much.
Anyone else from Roxanne's group? Cool Kids group?
It was exciting that we happen to have somebody in our group that is part of that new department in the Oregon Department of Education that is integrating services from the Oregon Health Authority. And that was such music to my ears. I am just super happy.
All right. Does another group want to go?
I can go. I didn't know what our group number was. We talked about how whether it was known or not, it should have been known what a lot of folks were going to come and share. You know, these are not new, this is not new information, right? And so OHA or CSAC could have come kind of with an action plan already in place and use those stories to drive momentum behind that action plan, and had maybe even checked that action plan in advance with the folks who were going to come share their stories to say, these are some of the steps we're planning on taking. Is this in line with what it is that you want to see us do, right? So that we're moving out of the listening phase and into the doing phase a little bit more quickly. And then we talked about being clear on what power CSAC has to affect change, so that folks know how to use that to be responsive, and being clear about the Oregon Health Authority and the sort of vast amount of power that it has to commit to making things happen. So assigning specific work, assigning people, right, setting aside, you know, hours in people's days to do this work, and being really clear about, like, okay, these are the stories we heard and this is how we're going to be responding to it, and you're going to spend 20 hours of your week doing this work. So funding it and investing resources, and then support from leadership. So leadership creating time to connect with the people who are doing the work and ask them what support they need. So maybe they need more flexible funding, or, you know, as the people are doing the work, they're going to know what supports they need, and really feeling like they can go to their leadership to get that support would feel action oriented toward the 2030 goal of eliminating health inequity. And then we also talked about, like, being direct in our language around what we're working on. So a lot of times we talk about eliminating health inequities, and that's sort of a broad system goal, right? But what is the work that we're doing right now? If we're working on preventing Black and Brown children from going into the criminal system because they're not being served by the education system or the healthcare system, or, you know, whatever it is, right? Then let's name that, instead of sort of using things that maybe are politically a little easier to talk about, but also much less impactful in terms of really getting the work done. There have been, you know, shifts in, for instance, how the public health system has responded to different drug epidemics, and how those have had disproportionate impacts in the Black and Brown community. And so understanding the history of that and how that relates to mental health and intergenerational trauma, and continuing to talk about that in frank terms and being honest about our understanding, instead of being afraid of being direct, because sometimes it's hard to get the work done if we're all interpreting these softer terms in our own different ways.
That's great. Thank you. Anyone else from Anna's group want to share? All right, I think we had 5 groups. Shanda took notes for one group and sent them already to Tamara. Does anyone else from that group want to speak for the group? Or you want to go ahead, Roberta?
I don't want to speak for the group, but I would like to hear what the summary of that conversation, what she captured.
Yeah. She says she apologized that it was very messy. She typed while you all were talking. Talked about someone sharing around that they were able to show and prove that their son was treated differently than all the white children in a high behavior classroom, which brought on more behaviors. The importance of inviting IDD to this, I'm assuming, to this conversation. Clarity of the role of CSAC, invitation to ODE's involvement in CSAC, training education staff to interrupt, not interpret racism, to recognize racism and the impact on students and families, and to respond well, early intervention, increased school-based mental health resources, training for ODE on how racism brings on high escalated behaviors in the classroom. How do we do better to communicate out the work that is being done? And how do we link the work happening in ODE and OHA so that it's connected and amplifying the impact? And there was a link to a Black SS work group that maybe CSAC would want to hear from them about their work. And then honoring the people who shared and presented at the March meeting and shared these recommendations with them prior to taking action so that they can have input and agreement on the recommendations from CSAC and from this group today. A child example of someone who sent home early every day, several times a week due to high behaviors, but it was not documented. Hundreds of restraints and seclusions in K through 2. Nothing positive to say about the education system or our district's practices. And then another example of getting out of a psychiatric unit after a suicide attempt, and the school district recommend putting her son in a different building and a program where he would feel, in quotes, more comfortable because it was the highest behavior classroom and most of the kids were people of color. And so just connecting the dots between those high behaviors and the racism, a huge tie between racism and behavioral health. And then there's gratitude to Roberta for sharing. So I think I summarized that well. Does that get to is there anything else you want to add?
I think there were two more things.
Okay, great.
And so one was requiring anti-racism training for all ODE staff, making it, like for my example, is mandatory annually for every employee who works in any school system whatsoever. That's an easy fix. And then I don't know, Bernardino, if you want to talk about it, but I thought you had a fantastic idea about getting day treatment programs into schools, like push-ins, especially in areas other than Portland and Salem, Portland and Eugene, where those aren't available,
Right.
to help support kids.
Yeah, and just thank you, Roberta. I just had mentioned how I really wish there were more day treatment, dual SUD mental health. There's very few, if not just less than a handful of day treatment programs. One that I heard of in Eastern Oregon, that they had to cut the high school one out because of funding and kept the middle school one, but it's mostly mental health focused. And after talking to the administrator from that school and having him give me an understanding of how they're set up with the day treatment program, he said that over half of their students had SUD issues, but it was mostly just mental health. And so I really wish there were more emphasis to implement more day treatment programs within middle schools and high schools for both mental health and SUD, given the dynamics that we're seeing within the state of Oregon with the fentanyl epidemic and the drug use with the legalization of marijuana and the unintentional consequences that has caused for the potency of the synthetics that are happening, causing psychosis just within 2 years, and kids using these drugs and their brains developing. I think the emphasis of we don't jump on board and get these things going, these services that are school-based, I think that we would be doing a great service to our children in the state of Oregon. So that's just what I shared.
Thank you, Bernardino. Carol, you have your hand up.
Thanks, guys. I'm not super computer literate here sometimes. So I keep listening and hearing it was LeGrand School District where they closed the high school day treatment program. I was a director then. Then we had a middle school program, and I'm still battling that as I've been retired. We had a really nice program going here, but we lost our we call it Center for Human Development here, which is our mental health facility. The lack of they're just apathetic. They're just apathetic. I don't know what else to say about trying to get kids services. So again, and I want to be very careful how I say this, but I come from a biracial family of if we could just start saying for all kids, every kid, for and if someone has more need, let's get those kids right to the top. It's about kids. It's about all kids. And I really trying to continuously fight the system. I'm now fighting it with parents trying to get kids services that we had here in Little LeGrand again, but we didn't get the support from our mental health agencies, and they've got umpteen zillion excuses, and I've heard them all over the years. So we're about kids. We're about all kids. You guys, you're doing all the right things. You're saying all the right things. I've wanted to hear this for so many years. If we could just get the services for kids that we know are out there, and we actually moved our day treatment when I was day treatment teacher. We moved our day treatment into an elementary facility. In fact, even when we had the middle school, it was right there on the middle school, high school campus. So it can happen, but we have to have all agency buy-in. We have to have about all kids who need services. That's my old lady spiel. Thanks.
Thank you, Carol. You're doing great with your technology. So I think we got to all the groups. Is there anyone else is there another group that I missed, or anyone else want to share their thoughts or impressions, or even respond to the other groups? Some good stuff happening in the chat.
I had a takeaway that from one of the meetings, and I think we kind of touched on it a little bit this morning, kind of earlier, but one of the things that came up at the very end of the meeting was, when we talk about these things, what are we doing? Sort of what's the what next? And one of the things that it made me realize is that there actually is work happening in some of these areas, but folks don't necessarily know about it. And so one of the takeaways that I took from the meeting was making sure that when people come, share their stories, talk about these deep impacts that they have had in their own lives, that we are connecting it to work, because I think that sometimes it feels like folks come and share a story and everybody kind of goes, oh, that's nice, and they kind of just move on with their day. And I think that having that feedback loop of, we heard you, it was important to hear you, we're taking that very seriously and taking policy action, even though policy action takes a very, very, very long time. You might not see that connection, but that may be one of the things that we can do better as a system, and at the very least as a unit, is that we can make sure that we are bringing sort of, you made a suggestion or you brought us your story and here's what we are doing about that, and that we are improving that feedback loop and getting back to folks. So it doesn't feel like people tell their story into a vacuum and no one really cares.
Yeah, and also doing that double check that I think Anna talked about, right? Of like, is this an intervention that would even meet that need? Is this the direction we're going with the work that we're doing, or the work that, what we heard, is that something that would even be meaningful to address what the concern is? Yeah, absolutely. I don't want to quickly move on, but I want to make sure that we talk about the what next.
Roberta's raising her literal hand.
Oh, is there another hand? Oh, sorry, I didn't see. It was in the
That's
grass.
okay. Thought off of what Jesse just said, because it's true. There's a lot of things, a lot of advocates and a lot of people are doing in communities and really spinning wheels on, if they're already in progress, they could be putting those efforts elsewhere. And so an idea would be that when people are going to come and present to this group, that if there is anything that's already in the works that your group is aware of, that they be informed, and or your team informs prior to the presentation, so that people who are waiting to go, oh yeah, but we need X, Y, and Z, and those are already done, don't have to be wasting their mental time, and they can really focus on what's being presented.
Yeah, absolutely. I mean, I think that was the biggest misstep that we recognized at the end of that meeting, right? Is that that was not organized. The intentionality was not there. We need to show up differently. Roxanne, the bear.
I just wanted to share in this space something that changed the way I viewed the Black Lives Matter situation. When I have 2 children who are in the BIPOC community who are involved in peaceful demonstrations in the Black Lives Matter movement. And during that time, I have always had very candid conversations with my children about every issue. There's not really anything that is not on the table to discuss. And so I had a very candid conversation with my son, Miko. He lives in Seattle, and about 2 things. One was I didn't understand why the term "all lives matter" was so offensive to some people, and I didn't like the term white privilege. And I'm just going to be really blunt here. So I didn't like the term white privilege at the time, because I felt like being white didn't save me from the things that happened to me in my childhood, right? So, and my son schooled me. He just had a really candid conversation, and it changed my view. And I think these kinds of conversations need to happen in the community. The first one was, okay, if you have a street and you have all these houses and they're very dirty and they're very run down and they really need to be repainted, and all of them could use some power washing, but one's on fire. Which one are you going to give the water to first, right? I mean, it doesn't mean that they all don't need this stuff, but this one is actually on fire. So we're going to talk about the one on fire first, right? Yes, it doesn't mean that the other ones don't matter, the other families don't matter, but they're not in danger of burning down in this fire, right? This particular fire. And so I was like, okay, so that made sense to me. Then I was saying, okay, so what about the white privilege thing? And he said, so I'm going to tell you a story, and this is actually true. I live in Seattle in a very, very urban area. I live in a high-rise apartment community. There's a market at the corner store. There's a corner store down the street. It's about 2 blocks, about a block and a half away. It was raining. I'm Black. I had my hoodie on because it's raining, and I'm running because I want to get there fast and get my milk so I can get back and eat my cereal. That's all I'm going to the corner store for, right? And I am stopped on the sidewalk by a police officer. First of all, do you think you'd have been stopped on the sidewalk by a police officer because you're running in a hoodie in the rain to get some milk to have some cereal? And I'm like, no. And he was like, okay. Well, in that moment, I had to worry if I had serious and legitimate concern that I would either go to jail or end up dead. If you were stopped on the sidewalk, would you be legitimately concerned that those two things could realistically happen to you or might be likely? And I'm like, no, not at all. And he said, in that moment, even if you never experienced white privilege in the whole rest of your life, in that moment, you did, because you didn't have to be afraid. That changed my whole perspective on white privilege and how intersectionality is absolutely an important thing to be talking about. Just wanted to share that. And I think those kinds of conversations really need to happen in the community.
Thank you, Roxanne. And some of the faces are going to another young visitor into our meeting. So
yeah, I must say I'm grateful for the comments. Sorry, I'm driving, but I must say I'm grateful for the comments by the lady that just spoke, because I think it's a highlight of blind spots. And sometimes we have blind spots. We just don't know what we don't know, and sometimes when you come to that aha moment, it's important to recognize and use that opportunity to also bring others along with you in knowing truly what some of these terminologies mean and what some of the histories that people have gone through have shaped their perspective, have shaped their fears and their phobias around things. So when you highlight something like, as for example, if I was a white person, I don't have to be afraid immediately when I see a police officer pull me over. Whereas if I was a Black person, then immediately I'm pulled over. There is already something going on in my body that tells me anything could happen. This stop could end up to be anything other than just I made a, whatever, I ran a red light or I was over speeding. So those things that run through your body they make us more aware. And that is why I think these conversations matter. And I think especially for the youth, I'm so grateful that there was a comment earlier about a meeting coming up in June that is focusing on youth and focusing on parents of Black youth, because I tell you what, these conversations are needed for our young people because they don't know what to do. And they're living in fear, and we like it or not, they're in fear, but they are at the places of work. They're in fear, but we go to church with them. They're in fear, but we have to do life with them. And yet they have this level of underlying fear and racial trauma that even though they try to show up as the best version of themselves, there is something inside of them that is crying out for healing, for attention, for support, for understanding. And unless we continue this conversation here in Oregon, we're gonna have to keep reliving the same instances, whether it's on the road or at the healthcare place or at the doctor's office or whatever. We have to open our minds to some of these words and terminologies and be the people that would educate each other. Just wanted to appreciate that comment and speak to how it touched me.
thank you, Carol.
She's driving, so maybe she can't see, but there were a whole bunch of heart emojis popping up in people's boxes while you were talking, Carol.
Hi, this is Danisha.
Oh,
I'm outside watering my garden right now, trying to give myself some peace today. But I just want to also bring just to folks' attention. I know we're talking about all of Oregon and we're talking about all of youth, and specifically that meeting in March was, I believe, inquired about Black youth in particular, and that's how we had folks come and speak. And folks like Roxanne, I think, shared her story then too about her son living in Seattle, which was a huge unrest during those protests. And so thank you for sharing that. But I also just want to say in the last week, so since last Friday, we've lost 3 Black men. So 2 are youth, 1 was an adult. When I say youth, I'm talking about under the age of 21, 25. So 2, I think one was one was 19, the other one was, I think, even younger than that. And the other one was in his 30s. So when I think about what services we have, what we provide, right? And I'm talking about the metro area right now. We have the Multnomah County who will reach out to that family and provide services, those families, and provide wraparound services for, if they have children, if they have family members who are, underage, to provide them, and the moms, dads, whoever, to provide counseling services. But what does that look like when those services end? And what are the parameters on those services? This is what we talk about when we talk about what kind of policies we have and what can we change. How are we strategic about how we contract out to our mental health therapists, specifically within the Black community? Those folks, which are some of my friends, are tapped out. They don't have the capacity to take on additional folks. They're doing the work that they're hired to do in their professional jobs and in their businesses that they have to be able to continue to reach community. They are, looking at contracting work, and just for their own mental health, who do they reach out to when they're tapped out and they're all done? It's a crisis, and I'm concerned that we're going into summer and we're already experiencing, 46% of gun violence happening in the metro area right now is Black folks. So what are we going to do about that? And how are we thinking about it overall? Because who's to say that some of their family members don't live in some rural areas in Oregon? They might, that are Black. So my question still just will remain, what can OHA do or CSAC do within the power and their control to help with this? I can name several things that used to happen that are not happening now when it comes to youth. Someone talked about taking them to church or being with them at church. Outside of those type of programs, I'll just speak again for the metro area. SCI can't save everyone. Herbally can't save everyone. Are we giving these community partners the power and the freedom with the funding that we give them to organize things like a skate night, a Bullwinkle's night, whatever it may be, to keep these youth busy and keep their mind distracted from their reality? Because, we all know when folks have time to think about what is happening, whether it was their dad, their uncle, their brother, whoever was recently murdered, what's going through their mind if they don't have resources to support them in that wraparound piece of it. So that's what I just wanted to share, just to make people aware that it's hard to do the work that I do, because I don't get a breath to have to continue to go back in and say, okay, this is another family that's being affected. What do we do? So I want to just share that as well, just so people are up to date with those current statistics that are happening right now in the metro area.
And I wanted to just quickly, sorry, I'm driving and I keep popping on and off. This is Nakobe. Add to that what Denisha just said, and think about the ecosystems in which, like, Black youth, and especially Black youth involved in gangs or families experiencing gun violence, are operating in. And in some of those ways, I don't think that it is just simply taking a clinical approach, but it's who are these folks who are providing the services to folks in gangs who have lived experience? Who are these peers? Who are these organizations who know the days that there might be more gun violence than there would be on other days, because they know who these folks are and they're here to support. And so I'm thinking, how do we also think outside of this dominant narrative of, well, if we just do this specific type of service, this is going to help? Like, what does wellness look like to families who are at risk of having their children shot? What does this look like to families who are having to bear the brunt of paying for funerals for their children? So just adding on that, and yeah, I think that's where I'm gonna put myself back on mute.
Yeah, that's right. I totally agree. I think there are more approaches to mental health and wellness than just the mainstream, going to the therapist's office and speaking to the therapist for an hour. And I think one of the ways is for us to open our minds and the possibilities of healing options out there that work for different communities. I must speak from an African perspective that going to a therapist's office is not usually the technical way an African person finds wellness and mental health. They like to do life in the community, and with that, they find the wellness. Having social connections and doing meetups where they can have fireside conversations, where they can open up and be vulnerable with each other, and yet be able to hug each other and say, you know what, you will go through this. That is how they find their wellness, and being supported in ways that make sense to them and make meaning for them goes a long way. The children, of the second generation immigrants, of many African immigrants here, struggle with the identity crisis because they are born of African parents, but they don't necessarily have the identity of an African because they were born here, and yet they're being raised in an African home. There is usually that struggle of, am I African, or am I African American, or am I just American? Yes, my color is a black of a black person, but I don't have the identity of an African because some of them have never gone to Africa. And then they're being looked at as an African American because they sound like that, and they may have some characteristics of that, but then they don't have the culture, the full culture of an African American. So then how do we support these children that are dealing with such a heavy identity crisis that leads them into addiction and all manner of, trying to look for attention somewhere else because nobody understands them. Their own parents don't even understand them either, because their own parents have a culture that is so different from how they're raising their children and what their children are exposed to. So I do think that they're in dealing with the crisis of mental health, especially in the young people, has to be broader than just therapy, has to go even to life coaching. I myself am a life coach. I'm a certified life coach. And I have found value in being able to provide support and healing for people without giving them a diagnosis. And they have been able to heal and recover from whatever crisis they're going through without labeling a diagnosis. I'm not against people getting a diagnosis, but there's some things that people go through that are not medical. They're just issues of life. And we have to recognize that and journey with people when they're going through a dark moment without giving them a permanent label, but yet helping them see that, okay, on the flip side, once you cross through this dark moment, this is, you're still this person. You're still this person without the label. And that is one of the things that Africans struggle with because of the stigma of mental health. And it's just a journey. I know that some of them is just because they don't know much about mental health, mental health therapy. But at the same time, there's a lot of stigma in some of these communities about you having this diagnosis and being looked at as different, or being looked at as someone that has to be maintained mentally by medically, so to speak. Anyways, I need to stop, but I hope I made my point.
You did. Thank you.
There was a really powerful quote shared last Friday. And I just want to recognize all of the women who have broken silo and really worked to engage and be in community. But a community member had said, "We are not a project." And that, I think, stuck with a lot of us, is that we as a very diverse, complex, multifaceted people with different backgrounds and different cultures within cultures, we're not a project. And so when we're approaching kind of what is our responsibility, what is CSAC's responsibility, what is our responsibility as state workers, like remembering like we are not a project. I'm part of my own community. And so when we're talking about this community, we're talking about me, we're talking about my family, we're talking about my family's kids, we're talking about my coworkers' families, my coworkers' kids. We're talking about all of this. I don't even know how to put it, but the mental health piece is huge. And yet we are not a project, because when we name our specific communities as projects to be fixed or to be strategically planned to help, that furthers the narrative, this us and them narrative, that furthers kind of that racialization of hierarchies of power, if that makes sense. It doesn't say, hey, look, like this is a community that needs specific community supports. It becomes a this is an us fixing them project, instead of this is a community, and the community needs to heal and be well, and the community is saying and has been saying, this is what we need to be well. We need life coaches, we need skate nights, we need places that we can be and healing around each other. And a lot of these orgs are doing this without the millions and millions in dollars of funding. So what would it look like to prioritize that? What could they do if they were given the same resources, if given the same type of investment attention as we give other forms of wellness, being within the medical model, or being peer support, or being something as simple as like sitting with elders and listening to stories of our history of resilience, as opposed to a project to fix marginalized communities, which in itself, again, I'm gonna go back on mute, but that was just my food for thought there. And thank you everyone for what I'm hearing as well.
Thank you, Nakobe. I'm also being mindful that Coffee's had his hand up for quite some time.
Yeah, can I go now?
Yes, please.
Yeah, thank you. I think Nakobe and Carol spoke a lot about what I was going to say. So I'm going to be brief by adding that families and community-based organizations have been doing the work, and they know how to do the work. They don't have a lot of resources, but they are doing it anyway. But they are doing it in a holistic way. They don't just focus on one aspect of their children's. So for example, when we're talking about community safety, it is connected to the use of drugs and substances. And it is connected to being bullied at school or in the street by other people. We spoke with some of our young people involved in gun violence issues. They don't consider themselves as gangs. They consider themselves as organization, people coming together to support one another, to affirm themselves. Because of the struggle that they have been going through, whether at school or in the streets, because of their identities, bullying. Some of them begin to smoke just because they don't want to be rejected by their peers. It's not that they have a need of, smoking or whatever. It's because of something that happens, peer pressure, saying, okay, if you don't smoke with us, you are not one of us and you're rejected. So that's some of the things that we heard from our children, you know, and especially our boys. I have 2 boys and 2 girls here in Oregon, and I can tell you what they have been through. You know, before coming to America 15 years ago, I told them, people are going to be touching your skin to see if it is dirty or not because you are a black person. So be prepared. And really, they, they did it from elementary school to middle school, you know. So how do we prepare our children? We are doing the work as families, but the lack of resources. So like Nico B and Carol were saying, if as a public agency, OHA, Oregon Health Authority, you are focusing only on one aspect of a thing, then you are missing the point, and you will not provide the right support to families and community-based organizations. So think of these things in a holistic way, and that's how the communities are doing it, the families are doing it. And as the communities, some of them are specialized in one or some aspects more than others, just because of the lack of resources. If they had the resources, they will work together and focus on all aspects of health for our children in Oregon. Thank you.
Yeah, thank you. Thank you everybody for showing up today. Again, I'm sort of humbled even on the Friday before a long weekend that this is where people chose to be and continue to elevate this conversation and the work that we have ahead of us together, again, to keep learning and getting this feedback, but also showing up and doing better, and the doing being that operative word. And I don't want to speak on behalf of our whole unit or sort of the work, because I think what I've heard loud and clear is that these are not just recommendations for what we oversee or have authority. This is really like talking to OHA and asking us to really do that assessment of what do you have authority over, what can you do, what can't you do, and then anchoring ourselves in that system of care value that we really need to be working with all the child serving agencies. So if we don't have the authority to do it, if we don't have the money to do it, who does? And how do we make sure that we're walking together so that we're not putting it all on a community-based organization to figure that out, right? So the more we can do at our levels of authority and responsibility of bringing that together, so that at a clinical level or a direct level, we're figuring that the payment on the back end, but also what I heard loud and clear today is around having that flexibility at the community level. I heard lots of things. That's just what you were just saying, just resonated with me around that system of care values, which is where we're coming from in children's behavioral health. So I'm being mindful of time. We're at 10 after 12. I think the then what, right? It's like the then what. I think there's a couple things of the then what. I think we need to sort of, again, add to what happened, add to this conversation what we heard in March and pull that together. I'm hearing an invitation for OHA to come back and talk about, of these recommendations or of the things that we heard, what is happening. It sounds like one of the feedback I heard today and what Shanda wrote down is like, we need to do a better job of even communicating what we are doing as it relates to the conversations that we've heard today and in March, and be able to loop back the recommendations to the group that presented in March. I heard that recommendation, and us being able to come back to you and say, okay, this is what we heard. Is this correct? So that constant feedback loop, while also really acknowledging and communicating really well what actions we are already taking, to see if they're the right actions or if they're not enough or we need to be focusing differently. A couple action ways to do some of that is what Hillary talked about at the beginning, and not everyone was here at the beginning, is that we are relaunching our parent policy work group that helped us develop the Children's Behavioral Health Roadmap that we're currently working off of. And our current roadmap, we basically looked at sort of 2020 to 2024, mostly because we had a Secretary of State audit in 2020. And that's when we sort of went out to community with our policy vision and got feedback, and then developed this work plan that we've been working on. But we really know that, again, the pandemic has changed things. We didn't have all the voices at the table. We weren't having these conversations back in 2020 at all. And so we know that we want to engage all of you to update and really continually update the roadmap so that it is doing all the things you said today, which is being responsive and doing prioritization, making things easier and showing up differently. So Hillary, I don't know if you want to put I think you may have put the information in the chat earlier. Oh, you're so good. See, you read my mind. So this is an invitation for parents, caregivers, however you all define that, to check in on that group, see if it's something that interests you. Feel free to share this information with others that may want or have the time. And this has been sort of a subgroup of CSAC. So it's a group that will then come back and communicate with this group as they do their work and review what we are doing and what recommendations they have to update the plan. So I think for the next couple meetings, I think being able to bring the information back to this group in June of all the things we heard in some sort of organized, beautiful manner that someone smarter than me will be able to figure out so that it's organized, and then being able to identify the things within OHA that are either targeting some of the recommendations, maybe doing some of the recommendations. And I think, like I think it was Roberta or someone say, what's out of our scope, and that we can communicate to other child serving agencies of the recommendations that we heard. For example, some of the education pieces. I also think we've been working off this roadmap, but we have a lot of different people here at CSAC than when we developed it. So I think some people have put some links in the chat, but I think us constantly reminding the folks of where that roadmap lives, so that if you so choose and want to dive into our Smart Sheet work plan, of seeing what we are up to and the staff that are assigned to that and the updates that we've done so far. Again, it's a beefy document, but I think it's important that we continue to communicate about it. And I think we want to share some data with you that we are tracking as system indicators, and some, hopefully if legislative session finishes, we'll be able to give some legislative updates. So I think looping back on these conversations of action and keeping that string going to the roadmap and the work of the unit, and making sure that all these recommendations are incorporated, elevated, and prioritized, and then continuing to show up with the information about the system. I think the last thing I'll say is that CSAC has gone through many different iterations in just my 5.5 years here. It has been in statute. It has been a very formal council with OHA. It has used to be all public meetings. It had an executive council. You used to have to apply to become a member. We had membership categories of all the different seats that needed to be filled for CSAC. We've gone to anybody and everybody come. We've had really low membership at times. Right now, we don't have a full executive committee that's running CSAC. So OHA has stepped in various ways to continue this meeting. So, and I think people are wanting to reimagine CSAC in different ways. And so I think the invitation is to potentially get a littler work group of those that are really passionate about sort of what this council could be. I heard Anna's group talking about like defining this and really walking with and learning the different things that councils can do within the state of Oregon to move legislation, move investments and things like that. I think there's a real opportunity because this council is not in statute, so we are not required to have any of those things, those structures in place that limit us. We don't have to be limited by the seats that are filled by whom. We don't have to limit how many youth and families have a seat on CSAC. We don't have and maybe that's not a great thing. Sometimes that helps create scaffolding for a group. We have bylaws, we have a website. So I guess it's an invitation from OHA to redefine what this group looks like. And I think having, you know, a group that's really passionate about that, to sort of look at what is and what has been, and really looking at what is the best opportunity for this council to make the most amount of impact that you talked about today. And I think we put out that invitation. So no one has to volunteer right now. I'm not asking for a show of hands, but if that speaks to your inner, like, yeah, I want CSAC to be X, Y, and Z, or I think CSAC should just be an open forum for youth and families to have access to leaders, or I want CSAC to have more of that structure so it has legitimacy with the legislature, or I want CSAC to be part of another group. I think we're open, because at this point, again, we don't have an executive team. We are not following our bylaws. We're not following all the previous scaffolding. And so that invitation is to all of you and anyone you know. And we can, you can email myself or Jesse or even Tamara when she sends out the minutes, if you have any interest in sort of being part of that work group to bring back some proposals to the larger group.
Can I make a quick recommendation?
Please.
For folks who may not get the CSAC email, is it possible for folks who are in this unit or in OHA who have like a position of leadership or are working on specific projects? Jill, I'm going to highlight your work here with the suicide prevention, to put your email in the chat now so that folks are able, and what you do, like your title and what you work on, so that individuals who might not receive the email have your contact information and can reach out to you.
That's a great suggestion. Thank you, Nakobe. So, but right before we leave, let's see. Oh, I just closed it. I was going to show the fun graphics. So we have done some graphics. I was going to give Hillary some props. She's been working on some graphics for our roadmap and some other things. But maybe we'll start our meeting in June with some of that work that's been happening around the roadmap, and how we're trying to, again, bring sort of that scaffolding and legitimacy to the work that is happening, while again, knowing that we aren't getting it right. We aren't doing it perfectly. We're still learning on community engagement. We're still working to amplify. We don't represent the communities which we're serving. So we're owning that in a way of saying, like, CSAC, you are a council to us. Let's walk together to really make this meeting meaningful. And then also the work that we're doing, make sure that it's responsive to the communities that we've been talking about and to all of you. Oh, there, Hillary shared it. Yeah. All right, well, I end with gratitude again for everyone who showed up today, and just know that we're open. We're here to show up with you and to make the system better, and whatever that system needs to look like, so that we're showing up in the right way. And have a beautiful long weekend if you get one.